thumbs up when we are.
Hi everyone, welcome back for our next live Q&A. The focus today is about flu jabs, and we have Sally here from Sarum Health Group. So I'm just going to say hello to Sally. She's the practice manager at Sarum Health Group. Give us a wave, Sally.
Hi everyone.
And I'm here as running the PCN and also in terms of as managing partner for Avon Valley Practice as well. So we're going to focus on the flu vaccine programme so that you know what's going on, what's happening, what to expect. We'll also cover what we know so far about the COVID boosters as well. So we'll do that too. So we're going to cover both things today. Before we go any further, in terms of general ops of the practice, some of you may have seen me on reception on Friday and seen me on reception today, and we're kind of going, oh, do I recognise her because she has a mask on? What was going? Yes, it was me, and indeed that just shows kind of where we're up to at Avon Valley in terms of the number of people we've got off sick, people who are isolating, and of course we do have people on holiday, and after 18 months we can't cancel any more holidays. So we've had a little bit of a tough time, but we are getting ourselves through it. We have had people with COVID. We've currently got a member of staff in hospital. We have had quite poorly people at the moment. All have been double jabbed. So just imagine what state we would have been if we hadn't been double vaccinated. Sally, is there anything you want to add?
We've had a similar sort of situation. We're short as well. COVID, sickness, holiday, and we're all doing our best to provide a good service. So please bear with us. Thank you.
Yeah, absolutely. So thank you for your patience. We are doing what we can do as quickly as we possibly can to be able to do that. Right. OK, so we are moving on into flu clinic. So to give you a background, OK, before I show you some very basic slides, because I have been on reception and I haven't had time to make everything look pretty, which is what I would much more prefer. So I have the raw detail of where we're up to on summary to do that. Our flu vaccine, our first lot comes in September and our second delivery comes in October. In principle, we're working on the concept that we're going to have 2 large vaccination days on Saturdays based at Lark Hill, a bit like what we did with the COVID vaccine to get as many of you vaccinated as quickly as possible. We're then doing a few shorter clinics the week following those Saturdays at the Avon Valley at Upavon and Durrington, and for Sarum Health Group at Millstream, because we're aware some people can't get to Lark Hill. So we are offering a few clinics. It's not as many appointments, but we have got them available to you. Before I go through those dates and those times, what I'd like to reassure you is that you will be receiving text messages this week, later on, probably Thursday or Friday, to book your flu vaccine appointment. And it will be really very much how you booked your COVID vaccines, whereby you were sent a text message, you followed the links and you were given a range of dates and times to be able to book. You booked the one that was convenient to you and you were able to turn up. OK, so that's the plan about what we're going to do. So it's a system that you already know. It's the principles of that. You follow the text message links to be able to do that. If you don't have a smartphone or can't access the text to do that, then we will be obviously trying to phone you and contact you to be able to book your flu vaccine. Just bear with us because we have the issues in terms of staffing to get to you as we can. So if you do want to phone up, do, but be prepared. That is not now. That will start next Monday for you to phone us to start contacting us to book appointments. But really, you only do that if you do not receive the text message to be able to do that, OK? Because most of you, according to our data, have text message facility to be able to book these appointments. So do that, because that'll be a much simpler way of getting the vaccine done, and also enable us to continue our normal services that you know we're struggling with due to the sickness, etc., and holidays and to be able to work with and make sure that we get you vaccinated as quickly as possible. Now, time for you. So what I'd like to see first of all is the map. So I'm going to talk you through what's going to happen on those Saturdays. Can I have the map, Stuart? Just waiting for Stuart to get the maps up. Okay, so this is what's going to happen on Saturdays. You'll recognise the building, okay, but we're going to do the reverse of the COVID programme. So in the COVID programme, just to get your bearings of this map in front of you, you were coming in at point 5. So this is where the exit is on the top right hand side of your screen, okay? That's where you were coming in before, if you can remember that. You'd walk all the way around the building and come into one of the fire exits, okay? Now, this time with flu, it's the exit, okay? So we're going completely round the other way. So to get yourself back out, remember where you walked out through those big double doors? For flu, you're going to walk into those big double doors. You're going to be walking in there. And we're hoping that some volunteers are going to be there to be able to take your temperatures, do your COVID screening questions, and give you a little piece of paper to hold. Remember those little bits of paper that had QR codes on them? For you, you're going to be given one of those. And you're going to join one of these 3 queues. These 3 lines don't mean anything. They're just ways to be able to keep you socially distanced through the waiting room to get through to the next set of doors, to get you through to where you're going to be moved into a consulting room. And we've got 5 consulting rooms live for the flu vaccine programme. Okay, again, the same rooms that we were using for the COVID vaccinations. Our GP or our doctor will be based in our medical kind of vaccine storage area, giving out more medicines, vaccines to the vaccinators, to be able to help with any queries, etc., to be able to do that. So you'll be coming through there and moved by a member of staff into a consulting room. You'll sit with a vaccinator who will vaccinate you, and we're hoping that we'll have volunteers with us to be able to do the data entry. Again, a bit like COVID, exactly that. And then after your vaccination, you'll move through from along the line as Stuart is kind of directing you as you go out the corridor all the way through to the exit, which was once the entrance, bear with us, and all the way out of the building back to your cars. Okay, we're hoping that way that we can keep more people in the queues, but actually we should be really quite timely with this. The flu vaccine is a very, very quick vaccine. You know it, you know what happens with it. We've got a quick data entry system, so all guns blazing kind of thing. We're going to be there with you throughout to do that. Okay, so that's the flow for the day at Lark Hill. If you're a patient at Avon Valley Practice, I'll be talking about Upavon and Durrington in a minute. And if you're a patient of Sam Health Group, Sally will be talking to you about the flows. But before we do that, I'm going to move on and talk to you about when those vaccine clinics are going to be held at each of those locations. So Stuart, can we get off this map and onto the very, very brief, very dull slideshow that I have done just now? Okay, cool. So our clinic days in September. Our vaccine will arrive somewhere from the Monday, the 13th, I think it is, and from that date, some from Monday to the Friday. We don't know when. So we're booking the first clinic on the 18th of September, because we know that we will have the vaccine at that time. The clinics will run from 8:30 until lunchtime and then start again and run until 4:45, and they'll be in Lark Hill. The 2-minute appointments, because we feel that we're able to see you through that pathway to be able to do that. Okay. In the week that follows that, so that's the week commencing the 20th of September, if you're a patient at Avon Valley, you'll be able to have your flu vaccine at Upavon surgery on the Tuesday afternoon or Durrington on the Thursday afternoon. Now, appointments there are spread at 6 minutes. The reason being is that we are still holding our normal clinics, and we have 3 clinicians each at both of those sites vaccinating, and should there be sickness, we won't need to cancel because we'll go down to a shorter period of time, say 4-minute appointments, but you won't need to have them cancelled. to be able to do that. At Sam Health Group, meanwhile, the clinics will run on Monday the 20th and Monday the 27th, and also Thursday the 23rd, and there'll be a meal stream for patients who need to get to Millstream into Salisbury to be vaccinated. And I think appointments are 3 minutes. And I'm just looking at Sally for a nod. 4 minutes, sorry, 4 minutes. So they're going to be 4 minutes long at Salem Health Group. Okay, and again, it all comes down to each practice ensuring you've got the right number of people in the waiting room, being able to be moved through, etc., etc. So it's a complicated formulary, to say the least. So that's what's happening in September. We then move on to October, and indeed our vaccine arrives on the week of the 4th of October at some point, Monday to Friday, we don't know when. Okay, and so the first clinic will be on Saturday the 9th. It will be at Lark Hill, and we're going from 8:30 until 4:30 with a lunch break as well for that. So we'll be running 5 clinicians again in the morning and the afternoon from that period of time. And then in the week following, the 11th of October, if you are a patient of Avon Valley, you can book appointments on Tuesday the 12th, Wednesday the 13th, Thursday the 14th. The first 2 being at Uphaven Surgery, that one on Thursday being at Durrington Surgery. At Salem Health Group, you'll be able to book appointments at Millstream Medical Centre on the 11th and 18th of October, both Mondays, and Thursday the 14th of October. So you'll be able to book those appointments accordingly when we release that information out on the appointment system when we invite you. You'll have all these different options to be able to pick from, to be able to do that. Okay, so that's where we're going in terms of the times and what to do and to look at that. And we will be sending out invites. We aren't booking anybody for flu vaccine appointments until we send out the official invitation that we expect will be probably Thursday, if not Friday. OK, we will confirm that to you and you will know that about what's happening. So please do not phone beforehand trying to book because they're not available to book. As soon as we make them live, the invites will be sent out automatically. OK, to be able to do that. We have set cohorts of people and we must vaccinate. So that goes on to the prioritization of who's going to be invited for the flu vaccine at what period of time. So we have the vaccine coming. We've got 2 types. One that's designed for people who are over the age of 65 and one that is booked, is appropriate. My screen just flashed then, you could tell it put me off a little bit, for people under the age of 65. So on the 18th of September, or should I say our September appointments, for the vaccine that's for over 65s, we will be prioritising our invitations to patients who are aged over 75. So we vaccinate our most vulnerable first, and then those people aged 65 to 75 will be invited to attend in October for our October appointments. So you'll find when the invitations go out in at the end of this week, if you're between age 65 and 75, in the first instance, you're only going to be offered appointments in October, whereas if you're over 75, you're going to be offered appointments in September. Okay. For our patients under the age of 65, there's nothing between any of you that we can risk stratify to prioritise. So it will be on a first come, first served basis. So you will have appointments available to you in September and October. OK, you book what's convenient to you. It is on a first come, first served basis to look to do that. OK, to do it. If we get more people signed up and want the flu jab than what we have appointments for, because we know that some people want it, some people don't, it always varies. We are still looking to see whether we can get additional supplies should all our appointments go and we haven't got any more vaccine left. So we'll wait and see on that, because it's always it's an unknown number when we have to order a year in advance as to how many people are actually going to want the vaccine from us. So bear that in mind just in case, but we are still working on that. OK, so that's where we're up to with the flu so far. I'm just going to have a quick look. We've got 4 questions posed to see what we've got so far. So Linda has asked about the flu jab being included with the COVID jab. We don't know when our COVID jabs are coming. I will talk about that in a bit, but we are not holding up our flu vaccine programme in case of the COVID vaccine. We've gone ahead with our flu jab because we know it's coming, we know when, and we want to vaccinate our community as quickly as possible. So that's what we are focusing on at the moment. Okay, so and then Peter has said about how he's worried that his elderly mother may not pick up the phone and dismiss it as a telesales, etc. if there's something wrong. Peter, if you put in the private who your mother is, then I'll check the records to see what the arrangements are for making sure she gets fit and vaccinated. I don't know which surgery you're at, so if you could say whether it's Avon Valley or it's House Group, that would be awesome. There's one other one that's just come in. Oh, it's just been published, I missed it. So John says we are aged over 65 but under 75. We are away from home in October. Can we attend in September? If we have enough vaccine left, we will go out. If we don't, after a certain time of uptake of over 75s, and if there's anything left, we'll go to our over 65s. But we've had to make that decision as a group to make sure that we are prioritising our groups. And I understand that that's difficult for individuals. I get that. It's not something that is easy to do, but we have to do that in order. In short, and that also means when we've got our vaccine that comes in, our first lot, we are also allocating vaccine for those people that are housebound, so they will be vaccinated in the first tranche as well. Again, the same rules that were applied for COVID, we're applying to the flu vaccine to try and make sure that our most vulnerable are vaccinated as soon as possible. Okay, so I'm going to stop talking for a little bit and I'm going to transfer over to Sally. She's going to talk to you about, if you're a patient at Serum Health Group, what the flow is for Millstream. If you're with Avon Valley, stay with us. I will be talking about what happens at Millstream and at Avon Valley, so up Avon and Durrington afterwards. And then once we've done that, answered any other questions, we'll then talk about COVID, which applies to both practices within our PCN. So I'll transfer over to Sally now.
Thank you, everyone. Just a quick overview on the flow. We are doing at Millstream, we're coming in the front door the normal way. You'll be checked in, your temperature. You'll go through to the consulting rooms, and we're using the 3 consulting rooms down the end of Millstream, and then your filter out will be out of the back door and back round into the car park. Anybody who did flu last year, it's exactly the same flow as we did last year, so that should keep it fairly straightforward. All I'd ask is if you could keep as close to your appointment time as possible, because obviously our space at Millstream is considerably less than it is at Lark Hill for holding people. And if you could come prepared with a short sleeve on for that, that would help as well. And the only other thing is there won't be parking on site, I'm afraid, because we just haven't got the facility to do it. Please, please use the central car park. Other than that, in through the front door, in for your vaccination, out through the back door. Thank you very much. Thanks, Anna.
Great. Okay, so it's going to Millstream nose, front door, through and out. And exactly the same for up Avon and Durrington. So if you're a patient at Avon Valley, you'll be coming through the front doors of both practices, walking through, going to reception for your COVID screening and temperature checks, sitting and waiting in the waiting room and moving forward. So please do come at the time of your appointment. You know, both surgeries have a limited amount of parking. Indeed, unlike Millstream in the middle of Salisbury, there's a central car park. We have parking on the sides of roads. We will aim to keep to time, but please come on time for your appointment. So, you know, come a minute before so that you can come straight in, sit down for just a moment, and then move on to your appointment with one of our vaccinators who'll be on site that day. Okay, so that's what's happening at Avon Valley to be able to do that. So I'm just going to have another look at the questions. We've had a few more since to be able to do that. We've got a question. So Joanna says, my husband is over 85 and I'm 69 but is carer. can I be vaccinated at the same time? Yes, because you have a 69. So you've got the same vaccine. So if we have enough vaccine left, then potentially yes, to be able to do that. Are clinically extremely vulnerable teenagers going to be in the first group or second? So indeed that they are in the under 65s. Okay, so in terms of being vaccinated, they will be invited accordingly. Now it depends in the programme of like if they're in year 7, they're going to be vaccinated by the flu campaign that's going to schools to be able to do that. So and I think they might be going to year 8, but don't quote me on that. I can't remember. So it'll be early teens. If your child is supposed to have a vaccine, they will be invited either through the school programme or from us. If they're clinically extremely vulnerable, they will be coming forward for that, and we will be vaccinating. Now, it does give a really good question here, and that is about child flu vaccines. We cannot book at the moment or arrange any appointments because we can't order any vaccine until the 1st of September. So, and we don't know how much we can get. So we are waiting on tenterhooks for the 1st of September for the central supply kind of ordering system to open, and then we will be ordering our vaccinations and find out when they're going to be delivered, and then we'll be looking at a programme. So I'm really sorry we can't tell you anything more about that at the moment, and of course that's the nasal vaccine as well. So bear with us on that point for that's coming. Now I can see a couple of other new questions. Okay, so to do that, which aren't relevant to flus. So, right, last bit about flu then, while I'm waiting for more questions, and that is about our volunteers. So the COVID vaccine programme was absolutely phenomenal with the 120 volunteers that joined us. Absolutely unbelievable. And I have to say, it was just uplifting. It was so much part of our community, and we thought, actually, if we're going to run this again for flu at a group level, do people want to volunteer again? Yes, we'll give you a flu vaccine. You may well have a flu vaccine anyway, to be able to do that. But if you would like to volunteer, that would be absolutely brilliant. Now, those people who volunteered before, all you need to do is connect in back with Helen. If you're a new volunteer and you want to find out more about that, then please do contact your practices through the dashboard. So that's through the website of both practices, explaining that you want to volunteer and saying which day you are available. Okay, either the 18th of September or the 9th of October. If you can tell us that, then we'll get in touch with you about that. So we need 14 volunteers for the morning in Lark Hill, okay, and 14 volunteers in the afternoon for both Saturdays accordingly. So if Stuart can actually just get the map back up, that would be great, because I'm just going to tell you the different roles, what they are. Fab. Okay, so we're going to have we'd like 4 volunteers at station 1. Okay, as people walk in, so there'll be 3 people at the front. COVID questions, thermometers, patient leaflet as in about flu, and finding out the cards to give to people. So as in their details. So there'll be 3 people there. 1 person in the middle of the waiting room, just guiding people along and cheering along. I'd love, entertainment as you're waiting, okay, to be able to do that. We'll then have a member of staff at station 2, but we'll have volunteers again at 4. So if you're interested in data entry on the computer, okay, if you're happy to help, then if you can volunteer here, that would be great. That would be sitting with one of our vaccinators, like you did with Pinnacle, be working with that to enter the data. We then have a volunteer at station 5, all the way through, at station 3 and station 5 to help guide people out of the building, who then move round, and we'll have a couple of volunteers at station 6, which is at the entrance stroke exit, to help guide you back to your cars about where to go. Okay, so that's the plan. There's 14 of you in total, and if you're interested, that would be awesome. So Roy has already put forward saying he'd like to volunteer. Roy, we'd love you to volunteer. That would be awesome. Okay, you're brilliant. You are brilliant. You're entertaining, and we had a great time the first time round, and so let's continue. So yeah, we'd love to see you again. And indeed everybody else of the other 119 of you that helped. But again, always open to new people. It's a really good experience. You can't really kind of quantify it, you can't qualify it in terms of the experience of what you get out of it. What you put in is what you get out. You see a lot of people, and I think for our lockdowns we were very fortunate as NHS workers, but also as volunteers, to see as many people as we did when other people didn't see anyone. So it was absolutely brilliant. So please, if you're happy to help with flus, that would be great. So if you volunteered before, contact Helen, and you've already got her details. If you haven't volunteered before, please contact us through the dashboard. That'll go to both practices, okay, to be able to do that, and then we'll get in touch with you about what you can do. If you can tell us which station you like, so as in at number 1, again, COVID questions, thermometers, patient leaflets, finding out bits of paper to hand round to people, that would be awesome. If you're a data, if you like IT, quite happy to do data entry, think about station 4. And then station 3, 5 and 6 are about guiding people out of the buildings. 6, you need to think about being able to be outside for a long period of time. So that does, some people like that, some people don't. So just be prepared for that. Going after people's cars, etc., etc. So whereas 3 and 5, you'll tend to kind of stay quite static in the same places, doing that and guiding people through. Okay, so yes, I think that's all we have about flus, and I think we've answered all the questions on that as well, to be able to do that. Okay, so we're now going to move into COVID. So COVID boosters, we have agreed to offer the booster, as you can imagine. Absolutely, we would, and that's the booster to all of the all the people that are with us, who were basically cohort 1 to cohort 9. So think people aged 50 and over, plus those who are clinically extremely vulnerable. That's our cohort again, all right, to be able to do that. We've signed the contract that with NHS England that we will vaccinate at some point from the 1st of September to the 31st of January 2022. We haven't been told when our vaccine is coming. We don't really know anything more than that as yet. Just know that when we know that we're going to get it, we're going to be acting very quickly to vaccinate you as soon as we can. In rough numbers, we're talking about 6,000 people, roughly, about that in that cohort that are with us currently who need to have that booster to be able to do that. We'll be looking at revaccinating our volunteers. If they can come back and volunteer for us, we'll be able to give you your booster during that time as well, to be able to do that, so we can keep the work going for that accordingly. So it will be the booster programme on that front. Once we know more, I promise you, when we find out more, we will hold another live Q&A to tell you more about what's going on. All right, about that. I think that is critical. We'll carry on doing that. We'll keep in touch. We'll use the same technology, I should think, in terms of inviting you to attend, etc. And I expect that it will be on priority again as well, in terms of over 80s, etc. Cohort 1, cohort 2, cohort 3 first, and moving down through the cohorts until we've covered everybody. Okay, remember, clinically extremely vulnerable people, regardless of their age, they have a condition that makes them more susceptible, are in cohort 6. So when we talk about cohorts 1 to 9, and we think about ages, that's quite simple to kind of think about. But remember, clinically extremely vulnerable people are in cohort 6. That includes carers who are vaccinated with us. So just remember that when we're talking about that element of the booster programme. To be able to do that. Okay, so I'm just going to have a quick look at the questions. Sally, is there anything else you want to add? No. Are there any questions that you want to answer? Just give no. Okay, to be able to do that. Right, so I'm just having a look down at Peter. Yeah, you sent a private message from what I can work out, so that's fine. To be able to do that, that's those ones. My 15-year-old would need the jab rather than spray at school. Is that an issue? No, it shouldn't be. Contact the practice about that, about what is happening, what's going on, so you should be able to be vaccinated, okay? But what I would do, again, you can give me your details on the feed. We won't obviously publish it. Tell us which practice you're with, and then Sally can take it forward if it's for Sarah Health Group. I'll take it forward if it's for Avon Valley, okay? To be able to do that. So yes, that's where we're up to. I hope that that's been interesting. I hope that you now know the programme, know that we are getting kind of ahead of ourselves. We're going to have to book those appointments so you know when you're going to be vaccinated for your flu. And like I've said, when it gets to the COVID vaccine, we'll keep you posted. All right, about that element of care. Okay, so I'm just going to give a minute. I can see there's another question just been posed about that. Okay, no, nothing else added. Right, okay, well, we're going to leave it at that. Okay, thank you so much for joining us. Really appreciated. Hope it's been useful, and we'll speak again soon. Okay, bye.